Are you struggling to understand why a loved one self-harms? This video provides a compassionate framework for carers. Learn how to respond effectively while preserving your own well-being. Self-harm is a coping strategy, not senseless behavior. It often begins in adolescence or early adulthood due to unbearable emotional distress. For those with personality disorders, it regulates overwhelming feelings or expresses shame. In borderline personality disorder, it follows emotional flooding or abandonment fears. Self-harm is an expression of distress, not a demand. Fear, anger, and helplessness are common reactions to discovering self-harm. You might want to stop it immediately or blame yourself. These feelings are understandable but not helpful. The best response is containment. Staying calm and offering safety. This approach shows love and support without judgment. Harm minimization accepts that stopping self-harm immediately isn't always possible. Shift from ultimatums to ensuring safety. Help clean wounds or explore other distress regulation methods. This approach protects life and builds trust. Many services recognize engagement as the foundation for change. Safety planning is not a no self-harm contract. It's collaborative and realistic, focusing on managing risk. Include early warning signs and crisis numbers. The goal is transparency and humane management. This approach reduces shame and secrecy. The course includes role-play examples for various situations. Learn how to respond to first disclosures and relapses. Avoid confrontation and validate their pain. You don't need perfect words, just steady kindness. Honesty about your limitations is crucial. Self-harm affects everyone involved, not just the individual. It can lead to anxiety, guilt, or grief for carers. Recognize your emotional responses as valid. It's okay to step back and seek support. Use therapy, peer support, and rest to refill your emotional reserves. Boundaries are essential for both you and your loved one. You're not their therapist or crisis team. Offer consistent, boundaried care without being available at all times. Hold space without having solutions. Being human, not superhuman, is what matters. Know what to do in a crisis. For overdoses or severe injuries, call emergency services immediately. For urgent but non-life-threatening situations, use NHS or Samaritans. Resources are available for both you and your loved one. You're not alone in this. Self-harm is frightening, but not hopeless. With time and support, people can learn to manage distress differently. You can't rescue them, but you can be a calm witness. Offer safety without shame. Care for yourself alongside them. Being a compassionate witness means being present without judgment. Acknowledge their struggle and offer a safe space. It's not about fixing, but about being there. Your presence can be powerful. Compassion is not failure. Various resources are available for carers. Carers UK, Mind, and local groups offer support. Find places to refill your emotional reserves. Peer support and therapy can be invaluable. You're not alone in caring for someone who self-harms. Self-harm is a complex issue requiring understanding and care. Respond with containment, safety, and compassion. Maintain your boundaries and seek support. Be a calm, present witness to their struggle. Care for yourself as you care for them. Supporting someone who self-harms is challenging but not impossible. With compassion and care, you can make a difference. Remember, you need care too.